Hi guys, today I'm reacting to season 10, episode 14 of Grey's Anatomy. It's called You've Got to Hide Your Love Away.
Hey Rory, how you doing?
Besides the fact that I have bone cancer, I'm great. Seriously, look at this polish. It's called Bad to the Bone.
We saw it at the drugstore and it was like God ordered us to buy it.
Hey, I don't take any orders from any god who gives me cancer twice.
Dude, your stupid brain cancer got us a puppy and your stupid bone cancer is getting us both out of finals.
You're right. Yay, God.
So we see a young girl who's had a brain cancer, and we don't know what type of brain cancer it was, but now she has a tumor in her bone. And I guess it's not clear yet if this is a metastasis from the brain cancer that she had or it's a new cancer. But in either case, the fact that we see somebody so young having had cancer, and especially if it's two cancers, that should ring an alarm bell that maybe there's a genetic cause for her cancers.
Take a deep breath.
All right, so today's gonna be a piece of cake. We're gonna stage the tumor, do a biopsy, and then we'll come up with a treatment plan.
This isn't a brain tumor coming back. I mean, it was 6 years ago, but...
No, I looked at Dr. Shepard's notes and his follow-up scans, and I really think that you beat that. I think this is a totally separate cancer.
Do you have any trouble breathing?
No.
She has decreased breath sounds. Let's add a contrast study to that staging CT.
Why? What do you think it is?
The contrast just gives us more of a detailed look.
Yeah, you know, and it'll give your toes a chance to dry before the biopsy.
Perfect.
Yeah.
Uh-oh, it sounds like maybe there could be metastasis from one of her tumors to the lungs.
It's a giant mass.
Could be a med. She had brain cancer 6 years ago, and Torres is doing a biopsy on a possible osteosarcoma.
3 cancers by the ripe old age of 16. That's bad luck or something genetic.
Bailey's gonna test for a link.
Right, so he's pointing out the fact that she's had 3 cancers. I guess at this point they don't know if the tumor in her chest is a metastasis from one of the tumors or is a brand new primary cancer. He's saying it could have been bad luck, or more likely it's something genetic. So it looks like Dr. Bailey is going to do some genetic testing for her.
What do you think?
Highly invasive. I don't think you can remove it without shrinking it first.
Yeah, but if she doesn't respond to chemo, then we still need to figure out a surgical approach that won't just kill her. We need to be as aggressive as this cancer.
Okay. All right, folks, you're gonna study her case files, look at the scans. I want you to come up with a surgical treatment plan.
Yep.
So, we're supposed to fill this whole thing up with the spit?
No, to the line. How? Think about dill pickles.
Oh my God, it works.
Every time.
And this is going to tell you.
If there's a genetic reason why you all keep getting cancer.
Well, it's got to be my wife's side. There's been a couple of breasts, a pancreas, a lung, and a butt. Oh, and Billy's balls. But we keep surviving.
Oh, so now it turns out that it's not just Rory who has the cancers, but there's also a family history of multiple people with cancers. And the combination of a brain tumor, a bone tumor, and the family history of multiple people with breast cancer is sounding a lot like a rare hereditary cancer syndrome called Li-Fraumeni syndrome. There's many other genetic conditions that can predispose to the types of cancers that he was mentioning in the family, but it's just the combination of those 3 types of tumors is sounding very suspicious for Li-Fraumeni syndrome, which we'll see if that's what they find. And that is commonly how genetic testing is performed. It used to be done more commonly through blood only, but now it's very common to do genetic testing with just a saliva sample. So that's what they were all doing. I don't know why they're testing all the family members at the same time. Usually it makes more sense to start by testing the person that has the cancer, Rory, seeing if anything comes up positive, and then we know what to look for in the parents and in the sister. But for some reason they're testing them all at once.
We beat cancer.
Yep.
That's what we do.
Well, the prelim path report looks like high-grade osteosarcoma, but we'll need another day to get the final report. We still need to figure out what's going on in her chest.
Yeah.
So the biopsy of the bone tumor confirmed that it's an osteosarcoma, and that is specifically one of the characteristic tumors of Li-Fraumeni syndrome. So with the type of tumor that she has in her bone, it's looking, again, very suspicious that this is what she probably has.
Oh my God.
Ready? I haven't even gotten started.
No, there's a mutation in the P53 gene.
What does that mean?
Yeah, so she called it the p53 gene. It's actually the TP53 gene, which encodes the protein p53. But being born with a mutation in TP53 means that a copy of that gene is not working, and that predisposes to Li-Fraumeni syndrome. So this genetic testing confirms that that's what's causing this girl's tumors and likely a lot of the cancers in her family. It's kind of hard to tell from the show what kind of time has elapsed, but they make it seem like it's all on the same day, and that is not what happens normally. Usually it takes about 2 to 3 weeks to get genetic test results. If you order it stat, it can be a little faster, maybe 1 week, but definitely not in 1 day.
Time to rethink the plan.
Hey, what'd you find?
Ooh, Rory has Li-Fraumeni syndrome.
Leaf for what?
Never even heard of it.
Neither had I. It's an extremely rare genetic condition due to a mutation in the p53 gene that suppresses the ability to regulate cell growth. The poor kid can't fight off tumors.
So as soon as you cure one cancer, another one pops up. It's awesome.
I'm a little bit surprised to hear that none of these surgeons have ever even heard of Li-Fraumeni syndrome. It's rare, but it's not actually that rare. It's estimated that between 1 in 5,000 and 1 in 20,000 people have this condition. And it's caused by a mutation in TP53. TP53 is a gene that everyone has, men and women. We all have 2 copies of this gene, one that we inherit from mom, one from dad. And this is one of the most important genes in our entire DNA, in our entire genome. It's actually been nicknamed the guardian of the genome. So if you're born with one of your copies of TP53 not working, you are really at high risk for many different types of cancers. And those cancers can happen anywhere, but the most characteristic tumors are sarcomas, and that could be soft tissue sarcomas or osteosarcoma, like a sarcoma in the bone, which is what Rory has. Brain cancer, specifically glioblastoma, is more common. Breast cancer, especially at unusually young ages, leukemia, and a rare tumor that happens almost exclusively in children that's called an adrenocortical carcinoma. So that's a rare tumor of the adrenal glands, which are the glands that sit on top of the kidneys. So if you see a combination of these cancers in one person or in a family, you should have a high suspicion for Li-Fraumeni syndrome. But there could be a huge spectrum of cancers within a family that has this condition. This season was filmed in 2013 at a time when there was a lot less knowledge about Li-Fraumeni syndrome. Also, right now, it's a lot more common to find this genetic condition incidentally, meaning sometimes a patient undergoes genetic testing through a big panel of genes because, let's say, they have breast cancer, but their family history doesn't look like a typical Li-Fraumeni syndrome family, but then they come back positive for a mutation in TP53. So over time, as more people are getting tested and people are being tested through bigger gene panels, which almost always include TP53, we are finding that this syndrome is not as rare as was previously thought, and also not all families present in the typical way.
Now, I'm meeting with the family today. I'd like to be able to tell them we have some sort of plan in place for Rory.
Okay, so that chest tumor might not even be a met from the osteosarcoma.
That makes chemo that much more complicated.
Okay, the tumor in her leg should respond to doxorubicin plus cisplatin.
Radiation's out. It makes her too susceptible to new tumors.
So it's true that in people that have Li-Fraumeni syndrome, since they have such a high risk for many different types of tumors and radiation exposure can increase their risk of future tumors, you generally want to avoid exposure to radiation. But in this case, it's not for diagnostic purposes, it's for treatment purposes. So this is potentially a life-saving treatment for her. If she could benefit from radiation, I don't think most doctors would shy away from giving radiation.
Chest tumor so vascular, even a biopsy would be pushing our luck.
How rare is this?
Only a few hundred families are reported in the literature. We need those case studies, but I mean, that could take a while.
Not if I get those resonance on it.
So there's definitely more than 100 cases published at this point in the literature. Still relatively rare compared to some other cancer syndromes, but it's definitely not as rare as it used to be.
All right, listen up. Your assignment's changed. Rory has Li-Fraumeni syndrome. It's rare. Dig up every case of it you can find out what worked, what didn't. I want one of you to look for Dr. Correa if he's with the oncologist.
I will.
Are you sure?
Yeah. Gotta face him sometime.
Now, you can't rely solely on the internet. Hit the library. now.
I guess because it was so rare at that time, there weren't a lot of online publications about Li-Fraumeni syndrome, so they wanted to look at old case studies that could only be found in books or maybe paper copies of publications.
Looks like we're gonna get you started on chemo soon.
Saw Mom talking to Dr. Bailey. There were tears.
Oh, wow. Thanks for the cancer genes, Mom.
If you have it, I have it.
Oh, you haven't been sick a day in your life. You have Dad's nice, safe genes.
Maybe not. Find out after the test.
You know, you don't have to find out if you don't want to. Knowledge sucks.
Your face sucks.
Come on. I'm not kidding. I know we like to act like this isn't a big deal and we're the family that beats cancer, but we're not actually beating anything. I mean, like, I can handle one cancer at a time, but it's all I see now, just cancer after cancer until I'm dead. And I wish I could go back and unknow that.
So she's saying that she wishes she didn't have the knowledge that she will have future cancers. And her situation is different because now she's overwhelmed by the fact that she's had all these tumors, has a third tumor now that is found in her lungs. But it's different for somebody like her sister who is unaffected by cancer at this point. Finding out that she has Li-Fraumeni syndrome could really be beneficial because there's very specific screening protocols that are recommended for people that have this condition, with the goal of trying to catch a cancer at the very earliest stage possible. And in addition to screening, there's also things that you can do to actually reduce your risk, like certain preventative surgeries. So some people choose not to know if they carry the Li-Fraumeni syndrome that has been identified in their family, but having that information is really important for screening purposes.
She can say no, right?
It's her decision.
According to Mom and Dad, they say I need to know because it'll determine whether I take an aspirin or get a brain scan for a headache. And if I'm gonna have kids, I need to know.
You're a kid.
I'm just saying. All right, Mom and Dad are freaking out and they're calling the whole damn family and wanting everyone to get a test and wanting to start a foundation and change the world and be like the family that fights Li-Fraumeni.
So maybe this is probably not the best time to be having this conversation. Like right now, they should probably just be focusing on the sister's treatment. And that's just so overwhelming to be dealing with the potential of finding out whether she has this condition or not and dealing with the unknowns of her sister's diagnosis. What she mentioned was the two important reasons for finding out if she has Li-Fraumeni syndrome. She said if she has a headache, should she just take aspirin or go for a brain scan? So of course, if somebody knows that they have Li-Fraumeni syndrome, the level of suspicion with any symptoms will be higher because we know that they're at higher risk for cancer. And the other thing she mentioned was in regards to her having kids in the future. So Li-Fraumeni syndrome is an autosomal dominant condition. That means that if she has the mutation, she has a 50% chance of passing it on to each child. So she might want to have that information so she knows if her kids will need to be tested, like if she's positive. Now, if she's negative, then her children can't inherit Li-Fraumeni syndrome. It's not something that skips generations. So if she doesn't have it, it stops there with her. Another reason why it's important for reproductive purposes is that if she's confirmed to have Li-Fraumeni syndrome, there are ways of preventing from passing it on. So she can go through the process of IVF, in vitro fertilization, and then when embryos are created in the lab, genetic testing can be performed on those embryos, and only embryos that have not inherited the TP53 mutation could then be implanted into her uterus, thereby really reducing the risk of passing on Li-Fraumeni to the next generation. But the most important reason for her at this age to have the information about whether she has a condition or not is cancer screening, because cancer screening starts in childhood. So this would be immediately applicable to her.
Here's what they want. What do you want?
I can really decide for myself. Even though I'm only 16 and my parents say that I have to, I can say no. I can make the decision.
It's your life. Nobody can make you do anything you don't want to do.
Yeah, that's 100% true. Nobody can force her to have genetic testing. I would hope that she would see a genetics professional to talk about the pros and cons of finding out whether she has Li-Fraumeni syndrome, because she might not be fully informed about all the benefits of knowing that she has this condition. Also, if she finds out that she doesn't have Li-Fraumeni syndrome, then her and her parents can be reassured that she's not at high risk to develop the cancers that her sister has and that are present in her family.
Ref, talk to me.
She was hypertensive and unresponsive with absent breath sounds over her left chest when I got here. I needled for attention pneumo.
Hey, we'll have to get her intubated. Okay?
Arrow, I need you to go find your parents.
I couldn't wake her up when the machine started beeping. I tried, but...
It's not your fault. We're gonna help your sister, okay? Go find your parents. Go, now! Where the hell did all this blood come from?
A tumor could have ruptured. We gotta get her to an OR.
Oh my goodness, poor girl. And poor sister that she saw that.
Guys, we just found a case of Li-Fraumeni in Chicago. The guy has almost the exact same types of cancers as Rory. They tried neoadjuvant chemo to shrink it, then surgery, then... And then he died.
Well, I would hesitate to compare her case to this case report that he found in the literature. I mean, that patient might have had the same tumors as her, but her prognosis also depends on what stage it was diagnosed at and what kind of treatment they may offer her. So it's not all gloom and doom just because this guy in the case report died. Also, that's another reason to have screening, because if cancers are caught earlier, they of course have a better prognosis than if they're caught later by the time symptoms show up.
Anatomy's all messed up. The tumor stuck everything in here.
Let's try clamping the aorta. That may temporarily help curb the bleeding.
Now I just have to find it.
This patient survived 6 types of cancers. They were onto something.
Yeah, but then he died from a surgical complication.
So if we combine radiofrequency ablation with an anterior approach in block resection...
Yes.
Oh, poor residents. They don't even know what's going on with her patient. I hope she gets a chance to benefit from their treatment ideas.
Defib, starting cardiac massage.
Charge the paddles, Lieutenant.
No. Look. This gives us good local control.
So we can treat the tumor without compromising the healthy lung tissue.
Exactly.
Okay, charge to 20. Clear. All right, we got rhythm.
It's weak, but it'll do. Hey, let's get in there and find this source.
And we can get a biopsy while we're in there to customize the chemo to her specific tumor.
This'll work, guys.
Yeah.
Let's go tell Weber.
Oh, that doesn't look good.
We figured it out. We start with radiofrequency ablation.
Can you take the remainder out in block?
And the healthy tissue remains healthy, guys.
But here's a twist. We do a biopsy. We'll customize her chemo.
Yeah, that's not gonna work.
It might have. It's a worthy pitch, but Rory bled out into her chest tonight.
It looks like a torn aorta. We did everything we could.
She died?
She died.
Take a look at yourself and make that change.
Oh, poor girl. I'm so nervous for how they're going to tell the family. This is just terrible.
We tried everything.
Oh.
Oh my God.
We're so sorry.
Do I have it? Gene, I want to know if I have it.
No, honey, now is not the time.
No, now is the time, Mom. I want to know. You know, Dr. Bailey told you.
Rio.
Do I have it?
Yeah.
It's okay. It's okay, Mom. I always wanted to be like her, and now I am. I'm just like Rory.
this is such a terrible condition, and especially the fact that it affects children. And when you take the family history of families that have Li-Fraumeni syndrome, there's often children or teens that have died. That's just, that was a terrible episode. Once the family finds out that there's actually this condition in the family, they can change the narrative for future generations, because a lot of these cancers we have screening protocols for. For example, because of the high risk of sarcoma that can happen anywhere in the body, annual whole body MRI is recommended. And at the same time, there's an MRI of the brain that can be done to screen for any brain tumors. Because of the high risk of breast cancer, annual mammogram and MRI are also recommended, and a lot of women actually opt to remove their breasts preventatively to minimize the risk of that type of cancer. Other screenings are recommended as well, and that's really the benefit of finding out, so that we can try to minimize the amount of cancers that develop in the family. Thank you for watching. I know this is a bit of a downer, but I hope it was informative in some way, and I hope you learned something new today. If you like this video, please give it a thumbs up and consider subscribing. I'm going to try to react to as many TV episodes that I can find that are related to hereditary cancer, so stay tuned for more. And as always, if you have any questions related to Li-Fraumeni syndrome or any other hereditary cancer syndrome, please leave it in the comments below. Thank you so much for watching. See you next time. Bye.